An Introduction to the Anatomy and Histology of the Human Eye. From the Department of Pathology at the Wills Eye Hospital and the Sidney Kimmel Medical College at Thomas Jefferson University in Philadelphia, Pennsylvania. The sclera is the white part of the eye. Its anterior surface is covered by the conjunctiva, a delicate, transparent mucous membrane that also lines the back surface of the eyelids. The pigmented iris, or colored part of the eye, is visible through the cornea. The pupil is an aperture in the center of the iris. The corneoscleral limbus is the curved junction between the cornea and the sclera. The caruncle is a small fleshy nodule located in the nasal conjunctiva near the medial canthus. The lens, vitreous humor, retina, and optic nerve are seen in this sectioned normal eye. The anterior part of the eye is composed of the cornea and the cavity delimited by the cornea, iris, and lens, called the anterior chamber. The anterior chamber is filled with watery aqueous humor. The vitreous cavity is the largest space in the eye. It is filled with the vitreous humor, the most delicate connective tissue in the body. The cornea is the anterior transparent part of the eye's external fibrous exoskeleton. The cornea is the primary refractive element of the eye. The cornea is composed largely of lamellae of collagenous connective tissue. Layers of the cornea include the epithelium, Bowman's layer, the stroma, Descemet's membrane, and the endothelium. Structures of the anterior cornea include the epithelium, Bowman's layer, and the collagenous stroma, which contains the flattened nuclei of fibroblast-like keratocytes. The epithelium, Bowman's layer, and the anterior stroma are seen in this scanning electron micrograph. Flattened squamous cells cover the surface of the epithelium. Deeper layers are composed of wing cells and basal cells. Microvillus processes cover the apical surface of the squamous cells. Higher magnification shows that some of these apical processes actually are small folds or microplici. The epithelium has a thin basement membrane that usually is inconspicuous in routine sections. The epithelial basement membrane rests on Bowman's membrane or layer, which is an irregular feltwork of collagen fibers shown in the electron micrograph below. The corneal stroma is composed of multiple layers or lamellae of collagen fibers. A sparse number of keratocytes with flattened nuclei reside in the spaces between adjacent lamellae. Artifactitious clefts form between the lamellae when the tissue is processed for routine sections. This false colorized scanning electron micrograph shows that the collagen fibers in adjacent lamellae differ in their orientation. A thick basement membrane called Descemet's membrane lines the posterior surface of the stroma. An extremely important monolayer of corneal endothelial cells is present on the posterior surface of Descemet's membrane. Descemet's membrane is secreted by the endothelial cells and thickens with age. Descemet's membrane stains positively with a PAS or periodic acid shift stain. This false colorized scanning electron micrograph of the posterior corneal surface shows the endothelium, Descemet's membrane, and the posterior stromal lamellae. Healthy corneal endothelium is seen in this scanning micrograph. The roughly hexagonal mosaic of the endothelial cells is seen at higher magnification in this micrograph. A healthy layer of corneal endothelium is necessary for corneal transparency. The endothelium maintains a state of relative stromal dehydration and collagen fiber spacing that is consistent with destructive interference and transparency. The lens and the zonule. The crystalline lens is the only transparent cellular tissue in the body. It allows the eye to change focus or accommodate. The crystalline lens is located in the posterior chamber behind the iris. It is encircled by a ring of approximately 70 or 80 ciliary processes that form the pars plicata or corona ciliaris of the ciliary body. The eye in this photo was removed because it contained a uveal melanoma. The lens is clear because the eye was sectioned prior to fixation. The lens usually turns yellow after fixation with formaldehyde, as is seen in this photo. The lens is located in the posterior chamber behind the iris. The vitreous humor, colored green in this photo, abuts the posterior surface of the lens and delimits the posterior border of the aqueous-filled posterior chamber. The space between the vitreous and the back of the lens is called the patellar fossa, or the retrolental space of Berger. Protein in the hazy vitreous of this inflamed eye highlights a channel in the center of the vitreous called Cloquet's canal. Cloquet's canal is the remnant of the perivascular sheath that enclosed the embryonic hyaloid artery that nourished the developing lens. The canal extends from the lens to the optic disc. A funnel-shaped expansion of the canal covering the disc is called the area of Marteggiani. The iris pigment epithelium, anterior lens capsule, cuboidal lens epithelium, and anterior lens cortex are seen in this photomicrograph. Due to sectioning artifact, the highly specialized lens cells or fibers that comprise the lens cortex are visible as flattened plates. The lens is surrounded by a thick basement membrane called the lens capsule. A folded sheet of anterior lens capsule removed during capsulorhexis is seen in this flat preparation. The inner surface of the capsule is lined by anterior lens epithelium. The lens epithelium is a monolayer of cuboidal cells on the inner surface of the anterior lens capsule. The roughly hexagonal mosaic of the epithelial cells is seen in the flat preparation. The lens capsule is PAS positive. The anterior capsule is much thicker than the posterior capsule, which is thinner than the diameter of a red blood cell. Near the equator of the lens epithelial cells elongate anteriorly and posteriorly, forming the secondary lens fibers or strap cells that form the bulk of this transparent cellular structure. Here, the nuclei of the cells extend into the lens cortex, forming the equatorial lens bow. The nuclei of the lens fibers gradually degenerate and disappear, and are absent in the deeper cortex and the lens nucleus. As we age, new layers of secondary lens fibers are continuously laid down around the periphery of the lens, like the layers of an onion. The secondary lens fibers are quite long and extend from the anterior to the posterior pole of the lens. Their ends form the Y sutures that delimit the embryonic nucleus of the lens. The anterior Y suture is upright, and the posterior Y suture is inverted. The lens fibers in the cortex are tightly packed in a paracrystalline fashion, shown here in this false colorized scanning electron micrograph. In the lens nucleus, adjacent lens fibers are held together by ball and socket joints that serve to minimize extracellular space. These ball and socket joints are accentuated in nuclear sclerosis. The zonule. The lens is held in place by the zonule of Zinn, a suspensory ligament of zonular fibers composed of elastic microfibrillar protein. Bundles of zonular fibers are seen bridging the gap between the lens and the pars plicata in these macro photos. A second posterior group of zonular fibers extends across the pars plana. These are highlighted by retroillumination in this macro photo. The posterior zonular fibers covering the pars plana are seen in this scanning electron micrograph. In this scanning micrograph, the zonular fibers cover the pars plana. The ciliary processes of the pars plicata are seen at right. The vitreous comprising the vitreous base has been desiccated during processing. Bundles of zonular fibers enter the valleys between adjacent ciliary processes. The anterior zonular fibers do not arise from the pars plicata. Rather, the latter structure acts as a fulcrum. In this scanning micrograph, orbiculo-anterior and orbiculo-posterior groups of zonular fibers are seen extending from the ciliary body to the lens. They enclose a triangular space called the canal of Hanover. The anterior chamber angle in this eye is artifictitiously closed. The canal of Hanover is visible in this macro photo. This scanning micrograph shows zonules inserting onto the anterior lens capsule. The iris. The eye is composed of 3 concentric layers or coats, which are readily seen during gross dissection. These include the outer fibrous exoskeleton composed of the sclera and its transparent anterior portion, the cornea, the middle pigmented and heavily vascularized uveal tract, and an inner layer derived from the neuroectodermal optic cup. The neuroectodermal derivatives that form the inner layer include the neurosensory retina in the iris, ciliary body, and retinal pigment epithelia. The 3 layers are seen in the posterior part of this section globe. The uveal tract includes the iris, ciliary body, and choroid. Early anatomists named this layer the uveal tract or grape-like tunic because they thought that the exposed structure resembled a purple grape. Uva is the Latin and Spanish word for grape. In this macro photo, the sclera has been removed from a blue and brown eye, exposing the uvea. The white ring around the iris of the blue eye is the ciliary muscle, which acts as a sphincter muscle during accommodation. When the muscle contracts, it lessens tension on the zonular fibers, which allows the lens to assume a more spherical shape that has greater refractive power. The iris is the anterior, visible part of the uveal tract and is responsible for the color of the eye. Gross anatomic features of the iris are seen in this scanning electron micrograph. These include the collarette, the crypts of Fuchs, and the contraction furrows. The pupil is the round aperture in the center of the iris. The thinner central part of the iris, delimited by the collarette, is called the pupillary portion. It is formed by resorption of the embryonic pupillary membrane. The more peripheral part of the iris is called the ciliary portion. Crypts of Fuchs are radially oriented oval or diamond-shaped defects in the anterior iris stroma. A large crypt is seen under higher magnification in this photo. Contraction furrows that form during pupillary dilation or mydriasis are found in the peripheral iris. Individual furrows extend only a clock hour or 2, and their ends interdigitate. Contraction furrows in the thin peripheral cribriform zone of the iris are seen in this scanning electron micrograph. The dendritiform melanocytes of the iris stroma are visible at this magnification. The peripheral cribriform zone is pocked by depressions. It is invisible clinically due to the overhang of the opaque sclera at the limbus. In this scanning micrograph, the anterior chamber and the anterior surface of the iris are viewed from a vantage point in the pupil. Highlighted by charging artifact, the trabecular meshwork appears as a bright white band at the top of the photo. The anterior surface of the lens fills the pupil, which is ringed by the pigment rougher frill, the anterior margin of the neuroectodermal iris pigment epithelium. The collarette, crypts of Fuchs, and contraction furrows are also visible. The cross-section of a lightly pigmented iris is seen in this photomicrograph. The thicker anterior part of the iris, called the iris stroma, is derived embryologically from the neural crest. The iris pigment epithelium is derived from the neuroectoderm. The iris stroma and the pigment epithelium, with its circumferential ridges, are seen in this false colorized scanning electron micrograph. The angle and trabecular meshwork are seen above. Melanocytes and pigment are concentrated in the anterior border layer of the iris stroma. The pigmented melanocytes and the pigment epithelium are colored brown in this micrograph. The deeper stroma is less cellular and is composed of areolar connective tissue and characteristic thick-walled vessels. The pink band on the anterior surface of the iris pigment epithelium is the dilator muscle. Pigment is largely confined to the anterior border layer of this lightly pigmented iris. The dilator muscle appears as an eosinophilic band, and vessels surrounded by a thick layer of collagen fibers are present in the midstroma, shown here under higher magnification. This scanning electron micrograph shows the thick coat of collagen fibers surrounding the stromal vessels. The collagen-clad iris vessels are located in the mid or deep stroma of the iris. In this blue iris, the vessels are readily visible because the cells in the anterior stroma lack pigment and are transparent. A small focus of early pigmentation has begun to opacify the anterior border layer at right. In this light brown iris, the vessels are hidden by pigment in the anterior stromal melanocytes. Pigment tends to be concentrated in the anterior border layer of the iris. The iris pigment epithelium lines the back surface of the iris. The iris pigment epithelium is maximally pigmented in all normal eyes, but lacks varying degrees of pigment in albinos. This macrophoto shows the lightly pigmented iris pigment epithelium in the eye of a tyrosinase positive albino from Africa. This patient had striking iris transillumination. The ciliary processes of the pars plicata and the iris pigment epithelium on the back surface of the iris are seen in this photo. The small circumferential and larger radial ridges of the iris pigment epithelium are evident. This scanning micrograph shows the smaller circumferential ridges of the iris pigment epithelium. The ridges are not continuous, and they tend to have interdigitating ends. Individual cells are visible at this magnification. Both the smaller circumferential ridges and the larger radial ridges of the iris pigment epithelium are shown in this SEM. The smaller circumferential ridges are oriented perpendicular to the larger radial ridges. Single iris pigment epithelial cells are visible in the scanning micrograph of the circumferential ridges at right. This scanning micrograph shows the cross-section of a single circumferential ridge. Large round granules of neuroepithelial melanin are present in the iris pigment epithelium. The dilator muscle is seen above. The large radial ridges taper as they approach the pupillary margin, where they form the pigment ruff or frill. The pigment ruff or frill is seen at higher magnification in this false colorized scanning micrograph. This beaded rim of pigment encircling the pupil represents the anterior margin of the neuroectodermal optic cup. The pigment ruff is the only part of the neuroectoderm that is directly visible with a slit lamp. Most of the iris that is visible clinically is the stroma derived from neural crest. The anterior surface of the iris has a spongy consistency. Flattened fibroblast-like cells partially cover the processes of the underlying dendritic melanocytes. In lightly colored irides, the sphincter muscle is often visible as a ring surrounding the pupil. The sphincter muscle of the iris is a separate structure that originally is derived from the iris pigment epithelium. The clump cells of Kogani are melanophages or detached pigment epithelial cells. The dilator muscle appears as an eosinophilic band on the anterior surface of the iris pigment epithelium. Unlike the sphincter muscle, the dilator muscle of the iris is not a separate structure. It is part of the anterior layer of iris pigment epithelial cells. In these electron micrographs from Hogan, Alvarado, and Wadle's textbook of ocular histology, the dilator is seen as non-pigmented cellular processes with smooth muscle differentiation that arise from the anterior layer of the pigment epithelium. The smooth muscle has filamentous cytoplasm with fusiform densities and is surrounded by basement membrane. A group of clump cells is seen in the stroma near the pupillary margin of this mildly pigmented iris. The electron micrograph shows a clump cell filled with melanin granules. Iris pigmentation. The iris is named after the Greek goddess of the rainbow, who served as the messenger of the gods. The term rainbow membrane occasionally was applied to this structure in the older literature. This term reflects the spectrum of iris colors found in different people that range from gray-blue, hazel, brown, and deep brown that may appear almost black. Radially oriented, undulating white lines dominate the biomicroscopic aspect of the blue iris. The white lines are the collagen-clad iris vessels located in the mid or deep stroma. As noted above, these are visible in lightly pigmented irides because the melanocytes in the anterior iris lack pigment and are transparent. As previously noted, iris pigment is concentrated in the anterior border layer of the iris. In darker irides, large amounts of pigment in the melanocytes opacifies the anterior border layer and obscures the iris vessels and other structures in the deeper stroma. Parts of a dark brown and a blue iris are compared in these photos, showing obscuration of the vessels in the brown eye. The melanocytes in the anterior border layer of the dark brown iris are shown in this transmission electron micrograph. The cytoplasm of the melanocytes contains numerous granules of melanin called melanosomes. In contrast, the melanocytes in this blue iris are almost totally devoid of melanin, and as a result are transparent clinically. Lacking melanosomes, the cytoplasmic volume of the cells is also markedly smaller. This macro photo shows a light brown iris. Most of the iris pigment resides in the anterior border layer. A moderate amount of pigment is also present in the triangular wedge of ciliary body stroma and muscle at right. The dark brown iris of this African contains more pigment, which also is seen in the deeper stroma. The ciliary body stroma is deeply pigmented. In the past, some authorities thought that there were more melanocytes in darker irides. Histologic studies suggest that all irides contain a similar number of melanocytes. In my thesis for the American Ophthalmological Society, I examined a series of different colored irises using electron microscopy. I found that the size and number of melanin granules increases as the iris becomes darker. The largest melanin granules were found in a case of oculodermal melanocytosis, or the nevus of Oda. The round granules of neuroepithelial melanin in the iris pigment epithelium are always largest. This chart shows increasing melanin granule size as a function of iris color. The intersurface of a blue and dark brown iris are compared at high magnification in this pair of false colorized scanning electron micrographs. Lacking melanin, the processes of the melanocytes in the blue iris are slender, delicate, and dendritiform. In contrast, the melanocytes of the brown iris are swollen with pigment. Blue irides appear blue due to the Tyndall effect. Longer, less energetic wavelengths of light are absorbed or dispersed by the iris stroma. Only the shorter blue wavelengths of light have the energy to return to the observer's eye. In summary, a relatively similar number of melanocytes are found in all irides, irrespective of their color. Darker irides have more melanin granules, larger melanin granules, and hence larger melanocytes. The ciliary body is the middle part of the uveal tract, between the iris and the choroid. It has two portions. The anterior pars plicata, composed of a ring of approximately 70 to 80 ciliary processes that encircles the periphery of the lens, and the posterior flat pars plana, or flat part, that terminates at the ora serrata. The appearance of the pars plicata has been likened to a crown, and it has been termed the corona ciliaris. The pars plicata, pars plana, peripheral retina, and the ora serrata are shown in this photo. The nasal ora serrata is identified by the presence of prominent dentate processes, which are separated by oral bays. In contrast, the temporal ora serrata is smooth. The dentate processes and oral bays of the nasal ora are seen under higher magnification in this photo. Dentate processes that traverse the pars plana are called meridional complexes. Several enclosed oral bays surrounded by peripheral retinal tissue are also visible in this photo. In this macro photo, the tips of the ciliary processes are seen in close proximity to the equator of the crystalline lens. After fixation, the equator of the lens may have an undulating margin. The aqueous humor is secreted by the non-pigmented ciliary epithelium of the ciliary processes. The ciliary processes in this photo show moderate hyalinization. The lens is absent. In young patients, the ciliary processes are relatively thin and pigmented. The pigmented ciliary processes in this infant eye are delicate and relatively straight. In older patients, hyalinization of the ciliary processes makes them appear irregularly thickened and white. The patient in this photo also has pars plana cysts and pseudoexfoliation, which highlights the zonular fibers. In the ciliary processes, a central vascular core is enveloped by a half-pigmented bilayer of ciliary epithelium. There is very little fibrosis or hyalinization around the vessels in this young patient. More hyalinization surrounds the vessels in this older patient. In this elderly patient, the ciliary process shows a marked degree of hyalinization. In a sectioned eye, the stroma of the anterior ciliary body has a wedge or triangular configuration that is thickest beneath the anterior pars plicata and tapers in the pars plana as it nears the ora serrata. The ciliary muscle is the major component of the ciliary body stroma. The smooth muscle of the ciliary body is arranged in bundles of longitudinal, radial, and circular fibers. The ciliary muscle is a circular sphincter. The longitudinal ciliary muscle fibers insert onto the posterior aspect of the scleral spur. This is the only spot where the ciliary body is attached to the sclera. A potential space is present between the muscle and the sclera in the pars plana. Fluid or blood can accumulate in this space in ciliochoroidal detachment or suprauveal hemorrhage. The angle and aqueous outflow pathways. The trabecular meshwork is the primary pathway for the outflow of aqueous humor from the eye. It is located near the limbus in the anterior wall of the angle formed by the cornea and iris. In this scanning electron micrograph, the trabecular meshwork appears as a bright band highlighted by charging artifact in the periphery of the anterior chamber above the insertion of the iris. This short video shows the flow of the aqueous humor across the iris toward the trabecular meshwork. The angle is seen in the periphery of the specimen. The inner uveal part of the meshwork, seen in this scanning micrograph, is composed of thin cord-like beams or tuberculi which are separated by irregular pores. The deeper corneoscleral part of the meshwork is composed of flat perforated sheets arranged in a lamellar fashion. The tuberculi and perforated sheets are covered by a monolayer of trabecular endothelial cells. Macroscopically, the trabecular meshwork is located between the scleral spur and the termination of Descemet's membrane called Schwabe's line. The scleral spur is a helpful landmark used to assess angle anatomy macroscopically and during clinical gonioscopy. The thickest part of the trabecular meshwork, which may be pigmented, is located central to the spur. This is sometimes called the functioning trabecular meshwork. The canal of Schlemm is a small, lymphatic-like vessel that collects aqueous humor from the anterior chamber and transports it to veins on the episcleral surface of the eye via intrascleral collector channels and the aqueous veins of Asher. It is located in the inner scleral sulcus between the corneoscleral part of the trabecular meshwork and the sclera. Like the trabecular meshwork, it is nestled in the anterior crotch of the scleral spur. Schlemm's canal, the trabecular meshwork, the scleral spur, and the greater arterial circle of the iris are seen in this scanning micrograph and in the following light micrographs. The beams or tuberculi forming the meshwork are composed of collagen with a central core of elastic tissue. They are enveloped by trabecular endothelial cells. There is no direct communication between the interstices of the trabecular meshwork and the lumen of Schlemm's canal, which is lined by endothelial cells. The monolayer of endothelial cells comprising the inner layer of the canal rests on a thin layer of juxtacanalicular connective tissue that contains ground substance full of glycosaminoglycans and glycoproteins. This juxtacanalicular tissue is thought to be the major site of aqueous outflow resistance. Lesser amounts of aqueous also egress through the iris and the posterior uveoscleral outflow pathway. The retina. The retina is the innermost light-sensitive layer of the eye. It is composed almost entirely of cells which are arranged in layers or lamellae. The retina is a 3-neuron system. The photoreceptor cells are the first layer. The second layer is composed of bipolar cells, amacrine cells, and horizontal cells. The photoreceptor axons synapse with the cells in the second layer. The bipolar cells synapse with the retinal ganglion cells in the third layer. The ganglion cell axons form the nerve fiber layer of the retina, which exits the eye through the lamina cribrosa at the optic disc to form the optic nerve. The ganglion cell axons extend to the lateral geniculate body in the thalamus of the brain. The giant glial cells of Mueller span the entire thickness of the retina and fill the spaces between the neurons. The internal limiting membrane is the basement membrane on the footplates of the Mueller cells. The layers of the posterior retina are shown in this photomicrograph. The inner layers include the internal limiting membrane, or basement membrane of the Mueller cells, the nerve fiber layer composed of ganglion cell axons, and the ganglion cell layer. Retinal layers located toward the vitreous are called inner. Layers located toward the sclera are called outer. The nuclear layers of the retina are composed of cell nuclei. They include the inner nuclear layer and the outer nuclear layer. The plexiform layers of the retina are composed of axons and dendrites. They include the inner plexiform layer and the outer plexiform layer. The photoreceptors are the outermost layer of the retina. Light has to pass through the entire thickness of the transparent retina to interact with the outer segments of the rods and cones. Parts of the photoreceptor cells include their axons or Henle fibers that comprise the outer part of the outer plexiform layer, the photoreceptor nuclei that form the outer nuclear layer, and the inner and outer segments that project through the array of intercellular connections called the external limiting membrane. The tips of the photoreceptor outer segments interdigitate with processes on the apical surface of the RPE cells. The RPE cells rest on the inner surface of Bruch's membrane. The choriocapillaris, the innermost layer of small choroidal blood vessels, is located on its outer side. The parts of a cone cell are seen in this scanning electron micrograph. They include the axon or Henle fiber, the nucleus, which is located in the outer part of the outer nuclear layer next to the external limiting membrane, and the inner and outer segments, which project through the external limiting membrane into the subretinal space. The photoreceptors, or rods and cones, are shown in this series of scanning electron micrographs. The parts of the photoreceptors that project through the external limiting membrane into the subretinal space include the inner segments and the outer segments. The inner segments of the rod photoreceptors are slender cylinders, while the inner segments of the cones have a conical configuration. The photoreceptor nuclei form the outer nuclear layer of the retina. The nuclei of the cones are located directly adjacent to the external limiting membrane. A red band highlights the external limiting membrane in this scanning micrograph. The external limiting membrane is a belt desmosome composed of leaky adherent junctions that join adjacent photoreceptors and Mueller cells. The inner and outer segments of the rods and cones are seen in this false colorized scanning electron micrograph. The photoreceptor nuclei form the outer nuclear layer, and the inner and outer segments project through the external limiting membrane. The cones in this scanning electron micrograph are colored red, blue, and green to emphasize that there are three types of cones that are sensitive to red, blue, and green wavelengths of light. Most of the outer segments in this photo are fractured and lost. The inner segments and the outer segments of the photoreceptors are seen in this photomicrograph. The inner segments have two components: the smaller myoid, located next to the external limiting membrane, and the larger ellipsoid, which is packed with mitochondria. The slender outer segments interdigitate with processes on the apical surface of the RPE cells. The photoreceptors blanket the outer surface of the retina, and their outer segments project into the subretinal space, shown here in the scanning electron micrograph. The junction between the inner and outer segments of a cone and rod photoreceptor are shown in these classic transmission electron micrograph from Hogan, Alvarado, and Wadel's textbook of ocular histology. The inner segments are tightly packed with mitochondria that provide energy for the photochemistry of vision. The mitochondria are found in the ellipsoid zone of the inner segments. A highly modified cilium connects the inner and outer segments. This connecting cilium has the 9+0 pattern of doublets seen in central nervous system cilia. The photochemistry of vision takes place in the outer segments of the photoreceptors. The outer segments contain a stack of discs composed of cell membranes. The visual pigment rhodopsin is present as a transmembrane protein in the cell wall of the discs. The arrangement of the discs in the outer segment has been likened to a stack of coins. A stack of Pringles potato chips is probably more appropriate due to their lipid content. The three membranes of the retina are shown in this diagram from Fine and Yanoff's textbook of ocular histology. The internal limiting membrane is highlighted in magenta. It is the basement membrane of the Mueller cells and is a true basement membrane. The middle limiting membrane is a linear band of synapses between the photoreceptor axons and the bipolar cells. It is located in the inner part of the outer plexiform layer. The external limiting membrane is not a true basement membrane. It is composed of intercellular connections called adherent junctions or zonuli adherentes that join adjacent photoreceptors and Mueller cells. In this scanning electron micrograph, the IOM has been peeled back, disclosing the retinal nerve fiber layer. This false colorized scanning electron micrograph of the interretinal layers shows the internal limiting membrane, the nerve fiber layer, a few cells of the retinal ganglion cell layer, and the inner plexiform layer. The internal limiting membrane is the basal lamina or basement membrane of the Mueller cells. It is the only one of the retinal membranes that is a true basement membrane. The IOM is secreted by and opposed to the basal surfaces or footplates of the Mueller cells. Extracellular matrix is attached to the basal lamina of the cells. The IOM serves as the attachment point for the fibrillar component of the vitreous humor, which is composed of fibrils of type 2 collagen. In this photomicrograph, the IOM is seen as a faint blue line on the basal surfaces of the Mueller cells on the inner surface of the retina. Mueller cell processes are seen separating bundles of ganglion cell axons in the nerve fiber layer. The red line highlights the location of the linear zone of synapses in the inner part of the outer plexiform layer, called the middle limiting membrane. Here, triangular cone pedicles and oval rod spherules synapse with the dendrites of bipolar cells and horizontal cells in the internuclear layer. Several cone axons or Henle fibers are visible. The photoreceptors project through the external limiting membrane. Only a few cones are present. The inner myoid and outer ellipsoid zones of the cone inner segments are visible. The rod spherules and cone pedicles are seen in this diagram of the middle limiting membrane from Hogan, Alvarado, and Wadle's textbook. In this photomicrograph, several capillaries of the deep capillary plexus are seen directly above the middle limiting membrane. The capillaries of the central retinal artery extend no deeper into the retina than the middle limiting membrane. The outer part of the retina is avascular and is nourished by the chorea capillaris. This false colorized electron micrograph shows the external limiting membrane of the retina, a belt desmosome composed of intercellular connections or zonuli adherentes that join the apices of adjacent photoreceptors and Mueller cells. The external limiting membrane is not a true basement membrane. It is also permeable or leaky. The inner and outer segments of the photoreceptors project through this belt desmosome like the cans of soda in this plastic six-pack yolk. Microvillus processes on the apical surface of the Mueller cells also project into the subretinal space. These are called the fiber basket of Schultze. To summarize, the layers of the retina are the internal limiting membrane, the nerve fiber layer, the ganglion cell layer, the inner plexiform layer, the inner nuclear layer, the outer plexiform layer, the outer nuclear layer, the external limiting membrane, the photoreceptors, and the retinal pigment epithelium. The RPE rests on Bruch's membrane on the inner surface of the choroid. A yellow spot called the macula lutea is present in the retina temporal to the optic nerve. This yellow spot is the basis for the commonly used but imprecise term macula applied to the posterior pole of the eye. The yellow pigment in the spot is derived from the diet. The area centralis, a more precise term, is applied to this area by anatomists. This refers to the part of the retina delimited by the superior and inferior temporal arcades of the retinal vessels, where the ganglion cell layer is thicker than a monolayer. The area centralis harbors the fovea or pit that is responsible for high-resolution vision. The fovea is about 1.5 millimeters in diameter, the same diameter as the optic nerve. The center of the fovea is located about 15 degrees temporal to the optic nerve. It is about 4 millimeters temporal to the center of the optic disc and about 0.8 millimeters below it. The foveola, or floor of the fovea, provides the sharpest vision. It is the only part of the retina that sees 20/20. The fovea of the same patient is imaged by spectral domain ocular coherence tomography and histology in this pair of photos. The layers in the OCT are generated by mathematical algorithms and do not correspond exactly with the layers seen in the histologic section. A single layer of outer retinal cells forms the floor of the fovea. The layer of outer retinal cells forming the floor of the fovea is composed of a tightly packed array of slender modified cones. The retinal pigment epithelium beneath the fovea is heavily pigmented. The ganglion cell layer of the perifoveal retina is quite thick, measuring 5 or 6 cells in thickness. In contrast, the ganglion cell layer outside the vascular arcades is an interrupted monolayer. The inner and outer plexiform layers of the retina appear quite different in this false colorized scanning electron micrograph. The inner plexiform layer is truly plexiform and has a spongy appearance. In contrast, most of the outer plexiform layer is composed of an array of photoreceptor axons or Henle fibers that are arranged in a parallel fashion. On either side of the fovea, the photoreceptor axons or Henle fibers are arranged in a radial fashion. The fovea would be located in the right of this photo. As noted previously, the deep plexus of capillaries derived from the central retinal artery penetrates only to the middle limiting membrane of the retina, which is not present in the fovea. This is responsible for the foveal avascular zone that is seen in this trypsin retinal digestion, or in fluorescein angiograms. The blood retinal barrier of the retina is shown in this photograph of the retina of an eye that was enucleated because it harbored a choroidal melanoma. The eye was removed immediately after the patient received an injection of fluorescein dye and was flash frozen and freeze dried. The inner part of the blood retinal barrier is composed of tight junctions that join the vascular endothelial cells. The tight junctions confine the fluorescein dye to the lumen of the vessels. The retinal pigment epithelium is the outer part of the blood retinal barrier. The RPE cells are joined by an impermeable barrier of apical tight junctions. The yellow line is lipofuscin pigment in the basal cytoplasm of the RPE cells. Unlike the retinal capillaries, the capillaries of the choroid capillaris are fenestrated and leaky. The choroid is filled with green dye, which is confined by the RPE. The retinal pigment epithelium is largely responsible for the red-orange color of the fundus seen on ophthalmoscopy. In this macro photo, parts of the RPE have been removed, disclosing Bruch's membrane. Large vessels are seen in the underlying choroid through denuded Bruch's membrane, which is largely transparent. In this focally denuded specimen, some of the smaller choriocapillaries are visible, in addition to the larger choroidal vessels. The hexagonal mosaic of the RPE cells is seen in this flat preparation. The scanning electron micrograph shows the hexagonal RPE cells forming a monolayer on the inner surface of Bruch's membrane. Some of the cells are hidden by inner photoreceptor matrix material. The RPE is derived from the outer layer of the optic cup. The apices of the RPE cells project into the subretinal space, where apical processes partially envelop the tips of the photoreceptor outer segments. Large ellipsoidal granules of neuroepithelial melanin are concentrated in the apical cytoplasm of the RPE cells. The nuclei of the RPE cells are present in the basal cytoplasm, abutting the inner surface of Bruch's membrane. The shape of the RPE granules is reminiscent of mouse droppings. Granules of neuroepithelial melanin are always larger than the granules in the uveal melanocytes. The large ellipsoidal granules in the RPE cells at right contrast with the fine dust-like granules in the choroidal melanocytes in this flat preparation. The basal cytoplasm of the RPE cells contains lipofuscin pigment. This is visible as myriad autofluorescent golden yellow granules in this fluorescent micrograph. The lipofuscin pigment is produced by the continual phagocytosis and digestion of the tips of the photoreceptor outer segments by the RPE's phagolysosomal system. The lipofuscin pigment accumulates with increasing age. The RPE rests on the inner surface of Bruch's membrane, the inner layer of the choroid. Bruch's membrane is an important anatomic barrier. Bruch's membrane appears as a white line beneath the RPE in this macro photo. Bruch's membrane is a sandwich of extracellular matrix material, shown here in this electron micrograph from Hogan, Alvarado, and Wadow's textbook. The two slices of bread include the basement membrane of the RPE and the basement membrane of the choriocapillary endothelial cells, if a capillary is present. Most of Bruch's membrane is collagen, and there is a central layer of elastic tissue. The choroid. Bruch's membrane lines the inner surface of the choroid, the posterior part of the uveal tract. The choroid and sclera are seen in this macro photo. The choroid is a richly vascularized layer of pigmented tissue. It provides nourishment to the outer layers of the retina. The choroid contains 3 layers of vessels. These include the choriocapillaris, Sattler's layer, and Haller's layer. The vessels of Haller's layer are larger and are located in the outer part of the choroid. The choriocapillaris is a network of fenestrated capillaries that is located directly beneath Bruch's membrane and the RPE. The choriocapillaris has a lobular arrangement, shown here in this scanning electron micrograph. Each choriocapillary lobule is supplied centrally by a precapillary arteriole and is demarcated peripherally by a ring of postcapillary venules. The pigment in the choroid is present within pigmented melanocytes. The choroidal melanocytes have a dendritiform configuration, shown here in this scanning electron micrograph, and in this light microscopic flat preparation. This macro photo shows the outer surface of the choroid, which has been peeled away from the sclera. Pigmented melanocytes fill the spaces between large choroidal vessels. In heavily pigmented individuals, this may give rise to the appearance of a tigroid fundus. A thin layer of connective tissue containing melanocytes remains attached to the inner surface of the sclera when the choroid is peeled away. This pigmented layer is called the lamina fusca. The dendritiform melanocytes found in the lamina fusca are seen in this high magnification macro photo. The amount of pigment and the size of the melanocytes varies with the color of the eye. The optic nerve enters the back of the eye about 15 degrees nasal to the fovea and optic axis. The nerve is composed of the axons of the retinal ganglion cells. The inner aspect of the optic nerve is the oval optic disc, which is approximately 1.5 millimeters in vertical diameter. The central retinal artery and vein enter the eye through the center of the optic disc and divide into 4 major branches that supply the inner layers of the retina. Compared to the optic disc, the myelinated part of the optic nerve behind the eye is about 3 millimeters in diameter. The myelination terminates at the lamina cribrosa, the sieve-like structure composed of pores where the axonal bundles egress through the sclera. The lamina cribrosa is visible in this scanning electron micrograph of a longitudinally sectioned optic disc and nerve. The nasal part of this normal optic disc is slightly elevated. The meninges of the optic nerve are seen in this scanning micrograph of a transversely sectioned optic nerve. They include the external dura, the spidery arachnoid, and the pia, which envelops the nerve and sends septa into its substance surrounding groups of axons. The presence of the central retinal artery and vein in this transverse section indicates that this nerve was sectioned relatively close to the back of the eye. The central retinal artery enters the substance of the optic nerve about 10 to 12 millimeters posterior to the globe. The dura, the spidery arachnoid, and the pia and piosepta are well seen in this scanning micrograph. In addition to the meninges and the piosepta, this light micrograph stained with H&E includes the central retinal vessels. These are seen at higher magnification in this micrograph. The central retinal artery is distinguished by its thick wall. This false colorized scanning electron micrograph shows that the central retinal artery and vein are contained within a common adventitial sheath of connective tissue. Compression of the vein by a sclerotic artery within this common adventitial sheath is thought to contribute to central retinal vein occlusion. Practical ocular embryology, derivatives of the neuroectoderm. The eye is composed of 3 concentric layers or coats. These include the outer fibrous exoskeleton composed of the sclera and cornea, the middle pigmented and heavily vascularized uveal tract, and the inner layer derived from the neuroectodermal optic cup. The neurosensory retina and the iris, ciliary body, and retinal pigment epithelia are derived from this inner layer of neuroectoderm. During embryonic development, an outpouching of polarized neuroectodermal cells develops on the forebrain. This optic vesicle is destined to form the inner layers of the eye. Epithelial cells, like the retinal pigment epithelial cell shown in this diagram, are polarized. They have an apex and a base. A basement membrane or basal lamina lines the base of the cells. This serves as an attachment point for the connective tissues of the extracellular matrix. Microvillous processes in a cilium often are found on the apical surface of cells. The cells typically are joined near their apices by intercellular connections or terminal bars. In this diagram, the outer basal surface of the optic vesicle is lined by a basement membrane, and the apices of the cells line the luminal surface. During embryogenesis, the optic vesicle invaginates to form the optic cup. As a result, 2 layers of cells become approximated in an apex-to-apex fashion. The optic cup is shown in this microscopic section of a 35 millimeter human embryo. The thick inner layer of the optic cup is destined to form the neurosensory retina, the non-pigmented layer of the ciliary epithelium, and the posterior layer of the iris pigment epithelium. The outer layer of the optic cup forms the retinal pigment epithelium, the pigmented outer layer of the ciliary epithelium, and the anterior layer of the iris pigment epithelium. The lens vesicle is seen within the cavity of the optic cup. The lens is derived from surface ectoderm. The iris pigment epithelium is derived from the anterior portion of the neuroepithelium. In the iris pigment epithelium, both the inner and outer layers of the optic cup are fused together apex to apex, and both layers are pigmented. The 2 layers comprising the iris pigment epithelium are better appreciated in this bleached section. As noted in a prior lecture, the dilator muscle is composed of non-pigmented cellular processes that contain smooth muscle that are part of the anterior layer of the epithelium. The dilator muscle is not a separate structure. The epithelium of the ciliary body is a half-pigmented bilayer. The outer layer is pigmented, and the inner layer is non-pigmented. The transition between the iris pigment epithelium and the ciliary body epithelium is seen in this photomicrograph. Both inner and outer layers of the iris pigment epithelium are pigmented, but the inner layer of the ciliary body epithelium is non-pigmented. Both layers are fused together apex to apex. The two layers of the epithelium covering the pars placata are seen in this photo. The inner layer is non-pigmented, and the outer layer is pigmented. The paucity of fibrosis in the ciliary process is consistent with a young patient. A dual layer of ciliary epithelium also lines the pars plana, or flat part of the ciliary body. The inner layer is non-pigmented, and both layers are fused apex to apex. The ora serrata is the junction between the ciliary body and the retina, and the ciliary body and the choroid. The term ora serrata means serrated margin or toothed mouth. This macro photo of the nasal ora serrata shows the teeth or dentate processes of the ora, which are prominent in this area. The dentate processes are separated by oral bays. In contrast to the nasal ora, the ora on the temporal side of the eye is relatively smooth. At the ora serrata, the non-pigmented ciliary epithelium of the pars plana abruptly thickens and continues posteriorly as the neurosensory retina. The pigmented ciliary epithelium continues posteriorly as the retinal pigment epithelium. Although these two layers are fused together in the iris and ciliary epithelium, the retina and retinal pigment epithelium are not fused together, and a potential space is present between both layers. The apical surfaces of these layers project into the subretinal space. Fluid collects in the subretinal space during retinal detachment or separation. This diagram shows the retina and the RPE, which are derived respectively from the inner and outer layers of the optic cup. The apical surface of each layer projects into the potential subretinal space. The basement membrane on the outer surface of the inner layer forms the internal limiting membrane of the retina. The collagen fibers of the vitreous humor are attached to this basement membrane. The basement membrane of the outer layer forms the basement membrane of the retinal pigment epithelium, which is part of Bruch's membrane. Microvilli are present on the apical surface of the RPE cells and also project from the apical surfaces of the retina's Mueller cells. Connecting tubules that resemble cilia join the inner and outer segments of the photoreceptors. Intercellular connections join adjacent Mueller cells and photoreceptors near their apices, forming the external limiting membrane. The RPE cells are joined near their apices by a series of tight junctions, or zonuli adcludentes, called Virchow's membrane. These tight junctions form the outer part of the blood-retinal barrier. Knowledge of the embryology of the neurectoderm and the optic cup helps us to understand the organization and relationship of the structures in the adult eye.